The NOFAS Affiliate Network is the largest and longest-standing coalition of FASD organizations in the United States. The network was established in 2002 and has grown to over 40 organizations across the country dedicated to preventing alcohol-related birth defects and helping individuals affected. Every year, NOFAS affiliate representatives gather in Washington, D.C. at the NOFAS Affiliate Summit. NOFAS has produced video interviews with many of these representatives, and you can watch the full interviews on our website and YouTube channel. Here are highlights.
We are very, very happy to be a part of the amazing network of NOFAS affiliates from across the country. And it's very exciting that NOFAS is able to bring us together every year and to really give us updates on what everyone else is doing. We can learn from each other.
I love being part of the NOFAS Affiliate Summit for various reasons. One of the things is being from state of South Dakota, it's awesome to be able to hook up and connect with other entities that are doing things in the United States or worldwide that come here and talk. It's a great community that we sit there and support ourselves, all realizing we're working on this together. It's a great resource to be a part of.
There's so much hope. You know, there is so much hope now because we know techniques that really work. And I tell teachers now that if they take the time to learn about fetal alcohol spectrum disorders, that I promise them, and I promise people listening to this, that it will make your job easier. It's worth the time. As human beings who care about other human beings, we can do this.
The most important role for NOFAS, as we think of it in the UK, is prevention, and that involves education and media and all the things we can do to raise awareness and help prevent the babies being born. And then number two is support, to support the families and all the people affected by FASD in every way we can.
I'm an advocate, and I'm motivated and sent forward by my children because they can't speak for themselves.
We decided, voted upon to join NOFAS because we felt like it would help us be able to collaborate with other states and utilize their expertise in getting our message out in a better way.
There's a big need to get the word out to youth about drinking and pregnancy and just the effects that it causes to your baby.
We want to collaborate with other organizations and make as much support available for families as we possibly can.
We have diagnosed over the years of our diagnostic team a little over 200 people.
We see there's a need for getting individuals diagnosed with FASD and then linking them to some kind of support services and treatments.
I think it's been a major blessing. NOFAS was a good help in that. I learned a lot of information from the NOFAS site.
If we can train one teacher or one special ed person to understand and be able to work with the kids differently and to see them through a different lens, then I think we've impacted a multitude.
Kids who are born without those kinds of deficits have enough trouble as it is figuring out how to survive in society. So why put them at a deficit before they ever get out of the womb?
What we're talking about are lifelong, very concrete changes in the brain that are oftentimes invisible. Alcohol is a known neurotoxin. We know that it's a poison to the brain. So it's hard to argue that there's a safe amount of a poison when we're doing everything else to make sure that our kids grow up happy and healthy.
We want everyone in the community to have the absolute clear message. There is no safe level of drinking, and if everyone in our community can certainly take to heart that message, I think we will have made an enormous impact, and that's really my hope.
What's fun about this work is when you first talk about FASD with people, sometimes there's a bit of a hesitancy, but once you start describing how FASD looks, everyone starts to have this light bulb go on. You could just see it in the audience. You look around and you could see, I have worked with people who have an FASD.
No alcohol is safe during pregnancy, and once we can get that message out and get doctors and treatment centers and just get it a part of everyday normal conversation, hopefully the day's going to come then when we don't have to worry about intervention because the prevention has done the job.
Our organization, Orchids, teaming with NOFAS, will help parents get the information that they need. We were looking for still looking for fundraising, and in the paper one day somebody had an advertisement for a gumball business. And so we're building our organization one gumball at a time because everybody likes a gumball. It's amazing. It's not big money, folks, but it works.
We put together this big FASD picture book, and this is just a great resource that we hand out to all the special ed directors in Macomb County. We're very proud of this.
My main mission for me is to wipe out this birth defect. You know, like I said, I don't want moms to have to think that they cause damage to their babies. If we can educate people ahead of time, starting from middle school, high school, get that message early so that they know if they start thinking about having a baby that their baby's not going to have fetal alcohol syndrome.